Excited to welcome to the program, Rural Doc, Alan Lindemann. Doc, what's going on, man? How are you?
We're doing really well here, Neil. And you?
Fantastic. And today's topic, how to monitor blood pressure at home during and after pregnancy. Can I monitor my blood pressure at home during and after pregnancy?
Well, not only can you, but you should. It's really a smart thing to do.
Why should I monitor my blood pressure at home during and after pregnancy?
Well, the problem with blood pressure is it occurs after delivery. That's when moms can get really sick. But it is the most common cause of return to the hospital after delivery. And it does add costs and morbidity, that is illness, to mom's course.
How do I monitor my blood pressure at home?
Well, it's pretty simple. You sit in a hard chair like a dining room chair or a kitchen chair, and feet on the floor, flat on the floor. Rest your forearm on the table. Your biceps should be at about the level of your heart, and you should have a biceps cuff, and that's the best way to get your blood pressure established.
What should I look for when I buy a blood pressure cuff?
Well, like everything, the blood pressure cuffs come in good, better, and best. The cheapest ones are probably not as accurate as you'd like. The most expensive ones have a lot of bells and whistles you don't need. So buy a middle-of-the-road price cuff. It will be accurate without a lot of frills.
What's the point of checking your blood pressure once or twice during and after pregnancy?
Well, you'd like to do it every day during and after pregnancy for several months anyway. And the reason you want to do it once or twice a day is you want to find out what is normal blood pressure for you, so that if you start varying from that, you will know where you've been and where you're going.
What kind of blood pressure elevation should I look for at home?
Well, if your normal pressure is 110/70, it will drop to, say, 100/60 in the second trimester. But if it goes up to, say, 125/80, you should call your doctor with that number. That doesn't necessarily mean that bad things are going to happen, but it is or can be considered a warning sign and something that you talk about with your doctor.
Should I report my blood pressure readings to the office nurses or to the doctor?
Well, of course, I'm biased. When I was practicing over the last 45 years, I did this all myself. And I think it's really important that you keep that relationship between the patient and the provider and forming a good partnership. I don't think this is anything to be pawned off on the nurses.
What's the point of managing blood pressure?
Well, you want to avoid serious illness and death. You can wind up dead from a stroke. You can have liver failure, kidney failure, paralysis. You could be a 25-year-old woman in the nursing home. So you don't want to have serious injury. And of course, like I said, you can even die from preeclampsia.
Why is the first elevated blood pressure so important?
Well, I've always considered it to be the herald sign. That is the canary in the coal mine. It's a very important first warning that something is going wrong. So it will give you the best opportunity to manage your blood pressure in a way that will save you the most trouble and cost.
All right. The best place to go is ruraldocallen.com and pick up Pregnancy Your Way, available today on Amazon. Thanks, Doc.
Thank you, Neil.
All right. That was the Rural Doc Allen podcast. Take care, guys.